Hello everyone, Abby here, Purple Cottage Crafts, and back with another finger update. So I just got back from my second therapy appointment today. It was originally scheduled for Wednesday, I guess tomorrow, but she had me come in today because of a scheduling thing. But so this is the splint that I have. I can't remember if I updated a picture or showed a picture or not. I don't remember. But this is my new splint, purple, yay! And this I have to keep on for at least 6 weeks, possibly 8, and because of the tear in the tendon. And when I went in today, she took off the finger. It's like a finger sleeve, that cotton thing underneath there. You can see that. It looks like a sock kind of a thing. So she took the splint off and the sock thing and was looking at my incision. And I won't show you guys because I know some people get queasy looking at incisions and things like that. So I don't want to gross anybody out. But and I'll explain these dots on my hand here in a second. Anyway, because there are blisters now forming where the sutures came out and around the incision, and that's not supposed to be there. So I had some complications similar to this when I had both my hands done in January of 2016, and it's happening again. So there's some reaction from, it's not from the plastic of the splint, because this started happening before, at least the rash on my arm, which is why I have the dots there. This happened when I still had the sutures and stuff in. So I'm not exactly sure what's going on there. But anyway, so she wants me to stop with the scar massage. I'm not sure if I mentioned that last time. If I did, please forgive me. But I'm at the point where I'm supposed to be doing what they call scar tissue massage. And it's where you basically, let's just pretend this is the scar and that's my skin. You just with some pressure, but not like full on, hard pressure. And you just gently massage along the scar line like that. And it helps break down that scar tissue. And it's especially important for me because I have keloids, and because I do keloid, and that's to help with that. So she wants me to stop doing that because of the blisters that are now, well, they've been forming since probably started late last week. And she wants me to stop doing that. And then I see her again next week, but I also see Dr. Vella, and that was my hand surgeon. I see him next week as well. So she wants me to stop the scar massage for now. And I'm still doing the fingertip ones where I just bend my fingertip like this. And I do 10 of these an hour. And then she also has me doing a new one that I can't do one-handed, where I take the splint off and then I bend the finger, but I'll try to do it on, let me see if I can let me switch hands for a quick second. I'll show you. Oh, sorry. Where I bend the finger and I'm going down just like that. That's it. No more than that. It's like 15 degrees, I think she said. And that's just to kind of keep that tendon moving and going, keep it gliding. But she doesn't want me to do it to where it starts to hurt. And I'm like, ooh, thank goodness, because it's tight. And just to kind of keep fluid, keep the tendon moving, the motion, so it doesn't seize up. So those are my instructions as of now. I can still shower with this on. I mean, she wants me to, I have to shower with this on because it's instinctual for us to want to bend all of our fingers. And of course, I can't bend this finger all the way because it's has to be worked to where I can do that again because of the tendon repair. But obviously it would hurt, and so I would stop, but I could inadvertently bend it just enough to where I tear the tendon or actually snap it, which is why she wants me to keep the splint on. So and I keep the cloth on because she doesn't want the plastic on the splint rubbing on the incision, of course. And then I just, let this air dry really well, and then I switch the sleeves there. I just switch that and put a fresh one on. So she doubled up this time. And so normally it's just like one. I should have got it out before I started filming. If I drop you guys, please forgive me. I'm doing this with just 2 fingers since I can't use my other hand. I have it in a sandwich bag just to kind of keep it clean, but this is what the sleeves are. I'm not sure what they're called. They come like on a huge long roll, much like seam binding does. And you can kind of see what that looks like. And so usually it's just one layer, but she puts the length, she doubles the length and cuts it, and then she rolls it back on top itself. So that's what she wants me to do, just to kind of keep down the irritation with the blisters and everything, and then kind of follow from there. Okay, so now if the blisters start to get worse, meaning if I get any more new ones, because I got 2 new ones since last night, she wants me to call my surgeon's office and then let them know and see if they want me to come in, because she seemed slightly concerned. She said that should not be there, but she's not the doctor, so I have to see the doctor for that part. So I'm also having, started developing an itchiness on my arm, pretty much 2 days post surgery because my arm was still kind of numb from the nerve block that they did once I was under anesthesia. And so I just attributed it to because they put on basically the tourniquet on my upper arm, and that's what they do. They don't do that until you're already under because it's so painful. And from what they tell me, obviously I don't know that, but they block it. It's called a beer block, BIER block, and you can Google that if you want to read about it, if you're interested. And so I just attributed the itchiness to that, it's from the cuff being on there, and then possibly, the betadine. I don't have an allergy to betadine or anything like that, but I thought maybe it was just a combination of that and just whatever. And you can kind of see, I'm not trying to be gross, but you can kind of see how I have, because I've been itching, so I've been bad and I've been scratching, but my arm is like red and kind of rashy. And this is new, what you see right here in the upper bottom right of the screen. That's just new since yesterday. So she took a Sharpie and she marked on the outline. This is exactly what you do when a patient has a rash or anything, because you want to see if it expands past that within a 24-hour period. And so she has some marks on my hand because it's starting to slowly creep up on my top of my hand as well. So if this, and when I wake up tomorrow, if the redness is past the Sharpie dots, it doesn't matter if it's just this section or if it's just this section or whatever. She said that she wants me to call my doctor right away and see if I need to be on some antibiotics or something like that. So that's a bummer because it's super itchy and I can't hardly stand it, and I'm trying really hard not to scratch it. But it's just annoying more than anything, I guess. And so I had a problem with this last time, and so they need to figure out what is going on with it's something in the OR. I don't know. And I know it's not the betadine because I've had, I've had betadine on other parts of my body when I've had my other surgeries and things like that, and I've never had a reaction before. It's something with the finger surgeries. I don't know what it is. So, but they're going to have to try to help, not, try to figure out what is causing that, because eventually, at my post-op when I had the stitches out, they looked at this one because he could see it was starting to form, because this is kind of how they start for me, this little bump like that. You see that on my pinky? And I usually let these go and go and go until they bug me so bad that I can't really stand it. And he said it's good sometimes to let them in the baby stage to get to where they're going to be, because sometimes if you take them out when they're smaller, he said like this, that the cells and whatnot aren't always gone, and so they have, like, you can't get all of it out, and so they have to go back in again if they do it too soon. So that is something that's eventually going to have to get done, but I'm going to wait until I can't stand it, because this is such, I'm not trying to be a baby about this at all. You guys know I'm not over dramatizing this surgery at all, clearly, but it's just such a pain in the tuchus to recover from this, because I seem to always break out with this rash. And I had this last time when I had my double hand surgery in January 2016. This happened on both. I think I already said that. Did I already say that? I can't remember. Anyway, this happened. I had to go to a dermatologist and get some cream, blah, blah, blah. So I don't know what's going on. But she said that my range of motion, as far as like me bending it, she said I'm doing really good. I've been very faithful and diligent with doing the 10, bending the tip down 10 times every hour. I've been very diligent at doing that. She said that that's looking great. So I'm super happy about that. The light's kind of going. So sorry, it's starting to get a little dark in the camera here, or the video. But anyway, so I'm really happy about that, because the goal is to get this healed properly so I can get my full range of motion back. I don't want to have any diminishing of the ability of me bending this finger and using it as I have before. If it's a little bit, it's going to be stiff, because these other fingers, these two here in the middle, and then my other hand, they're always stiff. It's like when I wake up in the morning, it's like me have arthritis or whatever. And it's like how it's stiff and the joints hurt when it's cold, that kind of stuff. I can deal with that. I mean, that's not anything I can't handle, but I just want to make sure that I get to where I can use my finger so I can get back to doing my beloved slow stitching and my different crafting and things like that. So I'm being a very good girl, and I'm not using my hand. I'm still not supposed to carry a bag, even though I can use these fingers and this thumb. When I'm using this hand or putting weight on it, it also puts weight on this finger and inadvertently moves the finger around in a position where they don't want it to be moved. And I'm just explaining what the therapist told me. So, I mean, I can pick up the remote control. That's not an issue. But she doesn't want me like carrying bags, carrying even like a bottle of water or lifting milk, nothing like that, she said. And so, I'm still pretty limited as far as movement and stuff, but you know, I'm getting pretty good using my left hand for things. So that's a plus. And but overall, everything went well today as far as like my range of motion with a fingertip. I started a second exercise, which is good. Just watching the rash, it's nothing as bad as my facial pain. So this is definitely something I can tolerate. It's just annoying. I'm sure a lot of you can relate when you have like a rash from whatever reaction to medication, or I've never had poison ivy. I'm like resistant to that, thank goodness. But it just gets itchy and it's just annoying more than anything. I don't have any pain hardly with my finger unless when I'm sleeping I kind of bump it on accident. But I've been sleeping with my arm kind of on a pillow just to kind of keep it up, so I don't accidentally like tuck it underneath my body when I try to sleep and stuff when I bend it or whatever. So it only hurts like that a little bit. Sometimes the movement of the splint onto the skin is uncomfortable, but I don't like having any pain. It's more itchy and more, I guess, just sore, kind of like, like how a bruise, I can't explain it. It's just more tender, I guess, than anything. So that's, totally doable for me. I was able to stop taking the pain pills they gave me post surgery, I think like 3 days after. So that was great, which is an improvement from last time I had it done. So overall, I'm doing really good. I have my laptop up here on the bed. It's right there. I'm going to start editing my video for my design team project for Tracie Fox using her, I think it's the wonderful wings. I can't off the top of my head, I'm so sorry, but it's her latest wings collection. It's going to take me probably it's going to take me a little while because it's, like I said, I think it's like, I know it's at least 25 clips minimum, just like different clips, and I have to type with my left hand. I tried typing on my external keyboard using this and like pretending this was my right index finger. It doesn't work, so I have to hand pick with my left hand. And I can use my pinky on the mouse pad, and I can click my external mouse like this and stuff. So it's just going to be a little bit slower going, but no complaints. I'm just happy that I'm able to, be able to sit up and to do something creative. I mean, editing video is creative, and that way I can have a chance to also get back to responding to comments. I'm at least hitting the heart, letting you know that I've seen them. It's still cumbersome for me to try to type too much with my left hand. I try to do talk to text, but it doesn't always pick up what I'm saying. And so I have to keep doing it 2 or 3 times, and that gets annoying. And so I just end up just hurting. And I'm trying to type more with my left hand. I can use my right hand to hold it and like type with my thumb a little bit, but it puts strain on my finger and I feel it and it hurts. And she said if I feel that, not to do that. So I'm trying to behave myself, because I don't want to do anything to mess up this tendon repair and not have full use of my finger again. So I'm just trying to really behave myself and doing what she tells me to do. So I think that's pretty much it. Yeah, I think that's pretty much it, you guys. So thanks so much again for your kind thoughts and comments and everything. And I promise I'll be back to doing crafty stuff. These non-crafty videos like the surgical stuff will start to cease once I get a little bit better, but I know a lot of you are wondering how I'm doing, and this does affect my crafting obviously, so I guess it's kind of relevant for this channel. But anyway, just wanted to check in, and I will see you guys soon. So I love you guys and miss you, and thank you again for all your sweet kind and comments, and I'm being very well taken care of, spoiled by both Steve and Kaylee, and all that stuff. So, and I'll keep you posted on whether with the rash, if you're interested. I mean, I won't be like gross or anything and that kind of stuff, but I might just maybe do a community post or something tomorrow if it looks like it's spread, or if there's more of the blisters and stuff. And I'm hoping not, because like I said, I want to get this healed and get back to where I can get back in my craft room and do some stuff. Oh, speaking of craft room, I got Steve got me a couple things off eBay. I'm so excited. So when those trickle in, I will definitely do a video. He'll take everything out to my room for me and get it set up and get my camera and everything set up for me so I can do a video, because I can show you guys stuff using my left hand. And that it's going to be some vintage like vintage items that are, authentic vintage items, but things that I can use in my crafting. And so I'm really excited about that. Plus it's kind of decorative as well. So once those start trickling in, I'll just do like a video where I should kind of show you some things that have come in thus far. I got a gorgeous vintage purple velvet autograph book, and it is just divine. I love it. I couldn't even properly look at it because it came like I don't know, 4 or 5 days after my surgery, I think. So it's in here in my room, but I'm not going to be able to show it to you properly. So I want to wait until I'm in my craft room and I can open it up and zoom in and all that good stuff. So, but it's just gorgeous and I love it, and it's purple and it makes me happy. So anyway, I'm done rambling, I guess now. So Gabby Abby here. I will see you guys soon. Happy crafting, happy planning, and happy scrapping. And do some crafting and stitching for me, please. Love you guys. Bye.